ADHD is attention deficit hyperactivity disorder, and it's a common neurodevelopmental condition which affects a child's and even adults' behavior. It's a common condition. People may not realize up to 3 to 5% children in UK and nearly 2% adults have this condition. And it's more commonly diagnosed in males than in females. It's there in all countries from America to Africa. The prevalence is bit more in America, nearly 8 to 10%, but in UK it's around 5%. But the real cause of attention deficit is not fully understood, but it's thought to be partly because of genes and the way the brain function and structure is devised causes this attention deficit hyperactivity disorder. ADHD, there is no simple, straightforward test to diagnose this condition, but a specialist person like me who has got expertise in understanding child's behavior and their development can diagnose this condition with varieties of assessment, including a thorough neurodevelopmental assessment, collecting evidence from the school teachers, parents, and even a computerized test. When parents or teachers cannot find these problems, we can make this diagnosis. Normally, a child specialist or even a child psychiatrist can diagnose this condition in this country. Undiagnosed ADHD has got a bad prognosis in children. It causes significant problems in a child's life, and this carries even onto the adult life. The child will have low self-confidence, underachievement in the school, poor social interaction with other children and adults, problems with discipline, self-esteem, risk-taking behavior, and much more than this. Difficulties go on and on if they are undiagnosed and untreated. ADHD is a neurodevelopmental condition. As the children grow, some of these things get better because they learn to understand that their behavior is causing difficulties, they are ending in trouble, and they're not having, although they know everything, they are unable to show it to the maybe teachers or to the parents, and it causes lots of problems with the parents-child relationship. There will also be problems with the teachers, their friends. But overall, it's been known that on a long-term basis, it causes poor school performance and even work performance in adult age. These people or children will have difficulty getting an employment, sustaining the job, and progressing in their career. They can have financial problems because these are impulsive or inattentive, and they might not have learned the money management skills. They can end up in trouble with the law, whether because of their risk-taking behavior. They are much more prone for accidents. They can have difficulties with their family, social relationship. They can have poor physical and mental health. Teenagers can have risk-taking behaviors. They can end up with anxiety, depression, if they're untreated and undiagnosed. Teenage is a very crucial part or crucial life period in a child's life. This is when even normal children will have difficulties, but children with ADHD will have much more difficulties because they are likely to engage in very impulsive, risk-taking behavior. They can try some substance or drugs. They can have unsafe sexual activity, end up with trouble. They might not be able to attend school or maybe get detentions, or their school performance may go down, and they may be excluded from the school. So this is one of the crucial things. for a long-term um, prognosis for a child, and this really starts coming up openly more during teenage years. Attention deficit hyperactivity disorder can be very well managed with appropriate treatment, and there is very good solid evidence, and this is one of the conditions that can technically be cured in with appropriate management, because we do have such great treatment options available now. This can be treated with both with medicine as well as combination of environmental modifications, behavioral support strategies, and general health promotion measures. So if a child has ADHD, these teachers need to put appropriate help and strategies for a child with ADHD in the classroom setting. And parents can go on training programs to understand these difficulties, their child's difficulties better, and to support their child in the home setting. General health promotion measures like diet, appropriate sleep, calm environment, regular routines, those things are very useful. And if all these things, along with this, we have very good medications that can help child focus better, learn better, have reduced impulsivity and making careless decisions. And the medications have been there for nearly 7 to 8 decades, and they're very effective medications which can technically cure this condition. Okay, ADHD normally comes with a baggage of problems. Like most commonly, these children will have autism, anxiety problems, depressions. They can have oppositional defiant disorder. That means they're very disruptive and negative, and not pay attention to the authority figures. They can have conduct disorders. They can end up with mental health problems. Most of these children have sleep difficulties, which can be helped with appropriate strategies and help. And most of these children also have what we call it as dyspraxia, also called as developmental coordination disorder, where their fine motor skills, spatial coordination, balance, and coordination is poor. They can be associated with tics, learning disabilities, and dyslexias.